Another thing that I wanted to mention when we're talking about overworking would be think about when you're using your knee that's just been surgically repaired. When you're going to sit in a chair, straighten your knee out. Don't use that to actually like when you're going to sit down, have both legs together, and then actively bending that surgically repaired knee. Straighten that out. I generally tell patients that are at that stage of the recovery to keep their knee straight, and then you're going to reach back with a hand onto the chair that you're sitting on and lower on your good leg, and then with both of your arms, and then keeping that surgical knee more straight. Because one of the things with overworking could be just bending your knee and sitting down like that. That's called a closed chain exercise, and a lot of surgeons would get really upset if they see you doing that type of sit. Now, it also, I mean, this is a pretty no-brainer thing anyway, because it's likely going to really hurt if you do that. So your own body is going to kind of prevent you from doing that most of the time. But when we're thinking about overworking, that would also be an example of something that you're doing that could be an over an overworking type of moment. And so don't do that. um, yeah. All right. Also, when you're working on achieving that full extension, when you're early on in this recovery process from having this knee replacement, you don't, when you're resting that knee, don't put anything underneath the knee. When you wake up out of the surgery in the acute care setting in the hospital, they oftentimes will have a knee bent there, but usually the PT will pull that pillow out from underneath your knee immediately when you wake up, and after that, don't ever put anything back underneath your knee because you are just facilitating the flexion. And as we say, extension is the most important thing. So you don't want to do things that are facilitating flexion, like when you're need to be working on extension as number one. So just remember, don't put stuff underneath that knee when you're resting or sleeping, and just because it just facilitate, or it's working against what we're trying to do, which is achieve full extension, getting that knee completely to zero.